To invite Mayor Diana Penniman to come and speak to us. Diana, of course, is well known in the district and a civic leader, and invite Diana to come forward.
Thank you, John, and a belated welcome to Rick and the leader of the opposition, Isabel, and also to the deputy leader, Nick. It's great to have you here with us tonight. And to the chair of our hospital here at Keith, James DeBarrow, and also the other board members that are up here on the stage with us. It's really a great feeling to stand here and acknowledge how the community has come out in support of your hospital here tonight. And to the people we can't see out in the Ruth Will room, and also the people behind us. That is what we need. We need to stand up and show strength and our support for the Keith District Hospital. And I'd just say at this stage that I do have a deep appreciation for this hospital. You all know that I live in Bordertown, but there'd be many here that don't know that our two boys were born here at the Keith Hospital with Bob Downing, who was the doctor at the time. And so my affiliation with the hospital goes back a long way. And there are people out there in the audience that I was actually in hospital with when I had those boys. Keith, the Tatiara, and regional South Australia is reeling from the devastating blows that were delivered to us in the wake of the state government budget recently handed down. Where have the government's election promises gone? In the eyes of rural and regional communities, we have an arrogant government, not listening to the people, even after their countless promises in the lead up to the last election. To listen to the people and communicate with their message. And I haven't heard that yet. As a town and extended community, the effects of the funding cost cuts to the Keith Hospital, if not brightened by negotiation, is looking at causing its closure. I ask these questions of the state government. What has happened to your government's social justice and social inclusion policies? Have they gone out the window, or are they only city-centric? Has the government stopped to carry out a social impact study on what the small amount in respect of the state budget, the cost of $370,000, if that's taken away from this hospital and the community? The flow and effects of a hospital closure are enormous. Doctors are likely to leave, as will our nursing staff, and business will suffer, school numbers will drop. It is like a deck of cards. I'm sure all of you here tonight realise that these facts very clearly, but somehow it is not recognised by the number crunchers in government departments and the government itself. It was only yesterday I received an official letter informing Council of the closure of the Purser office here in Keith, which is happening tomorrow. It's only 2 days that Council has had notification that that office is closing, and yet the government keeps calling on local government for greater communication between local and state governments. And the closure of that office is 3 more jobs lost to Keith. And I ask you, where is the government's communication skills? Council has always acted as an advocate for the Keith Hospital, including supporting grant applications, meeting Minister Hill, providing a council rep on the hospital board, providing grants over the years to assist the hospital for projects, sealing bitumen areas around the hospital, including the helipad, rent assistance for doctors, assistance to fund locums, improvement of the hospital house, and these are only just some of the areas of help. We have agreed to a separate rate on West Ward ratepayers to help fund and upgrade the aged care wing, and also agreed to another separate rate on West Ward ratepayers to help fund the development of the Health Hub, which is to be opened next month. The new medical centre at Pathway, with funding from 50% from council and 50% from the federal government, and serviced by Keith Doctors, is another project, as many of the Pathway residents use Keith as their base. The importance of the Keith Hospital has been recognised by the federal government. They have provided considerable funding to these latest projects, the aged care wing, the Health Hub and the Pathway Medical Centre. It is very strange that one level of government recognises the importance of the Keith Hospital, whilst the other, state level, announces it is cutting grant funding that may result in a closure. Council has requested a meeting with Premier Rann to discuss these cuts. He received our letter 2 weeks ago, and after I had spoken with his PA, and as yet we have not received any acknowledgement of that letter. As a council, we are prepared to act as an advocate in finding a way forward so that the Keith and District Hospital remains open and the town retains its vibrant and visionary community. I would like to thank the board and the members of the action group for the actions that they have taken over the past 2 weeks. You have a very dedicated group of people serving on that board, and I ask the community